Wherever you are in the world, your government and big businesses, their corporate partners, are finding ways to exploit your data. If you're in America, they're using vaccine information to market to you, corral you, manipulate you. And if you're in the UK, then your GP private medical records are about to be sold to the highest bidder. Fortunately, in the case of the latter, there is something you can do, so stay to the end of the video to see how you can opt out of that. If you're in America, things are a lot more challenging. So in the US right now, data rights organisations have warned that patients lack a clear understanding of how information about their health, employment, contact or location details may be used if it's collected by private entities during the COVID-19 vaccine drive. So while vaccines are being promoted, we talked about the other day through dating apps and stuff, the data that is being harvested is being utilised in ways that aren't explicit or clear or directly even related to COVID or health, which is cause for concern. Privacy advocates warn retail pharmacies in particular are blurring the line between public health and commerce. For example, Walgreens required all customers seeking vaccine appointments to make an account, including an opt-in to marketing emails. Now, in England, the little country where I live, pharmacies, you think of them as some little village shop with a geezer in a little white coat handing you your little tablets. In America, it's Walgreens. You're having a relationship with a giant corporation that now, as well as selling you stuff, sometimes things you don't need, promoting products that aren't good for you, is also harvesting your data right back again. In a sense, this points to the fundamental problem that exists when there are relationships between governments that create regulation and corporations that benefit from that regulation, or more likely, lack of regulation in an instance such as this one. Also, at a time where there's so much trust required around coronavirus, the idea that there will be any objective other than health objectives, it fuels the fires of doubt that are raging around the world, naturally. The company also encouraged people seeking vaccine appointments to join its loyalty program, which supplies data to the pharmacy's advertising arm, Walgreens Advertising Group. What kind of one-way street loyalty is this? Join our loyalty program. Okay, there's some loyalty. Thank you. There, give that to the marketing arm. Like, loyalty is meant to be a two-way thing. Otherwise, what kind of loyalty is it? Look at how corporations and governments have to evoke your natural emotional tendencies and your inherent goodness to further bludgeon you into dumb compliance and into cooperating with programs and projects that don't, in fact, have your best interests at heart. Meanwhile, in the UK, Matt Hancock, he's the health minister, in case you were wondering, is conspiring to sell private medical data to, well, I mean, possibly anyone who wants it. Says, in the UK, Matt Hancock has quietly told your GP to hand over your health data. This is the biggest data grab in the history of the health service. From July the 1st this year, if you're registered with a GP in England, the government will be taking a copy of every medical event your GP recorded on their system since you first registered with them. Your children's record too, if you have children. There's an interesting lot of protocols around medicine because you're talking about things that are deeply private, mental health, sexual health, talking about things, I think, with the assumption of absolute privacy. When people say, oh, Russell, you're a Marxist socialist, someone say that as well as, Illuminati. I always say, well, I'm bloody not, because I don't want the government having power and control over my family life and my private life. I think I can handle my life myself, thanks very much, in cooperation and collaboration with other people based on mutual respect and mutual relationships. I don't need the state to be involved in any of my stuff. Do you know what I mean? That's where I stand on this, because I do not trust the government. Do you? Do you trust them? Do you trust the incentives of any big business when they have the incentives that they have? We have to enter into a realm of real giddy assumption to have that kind of trust. We have to assume, okay, they're in it for the profit, but they'll only make profit if they do the right thing. Well, that's not actually how it works. As long as they can conceal wrongdoing, as long as they can be advantaged by relationships with government, there's a kind of, carte blanche to do what they want. You only have to look at the kind of history of big pharmaceutical companies, big energy companies, to see the number of transgressions, to see how long it took for those transgressions to be exposed, to see how little comparatively they had to pay out as a result of transgression. And I'm talking about sort of life and death heavy stuff. So These are the kind of relationships that actually cannot be allowed to flourish. They have to be stamped out. Fortunately, in the case of this GP one, there is something we can do, which I'll tell you about in a minute. According to the NHS website, it will include this data that's going to be shared. Data about diagnoses, symptoms, observations, test result, medications, allergies, immunisations, referrals, recalls and appointments, including information about physical, mental and sexual health. That's terrifying. And also calling it, like, you know, putting it through the NHS website as well. What that is intergovernmental branding. They've realised that the NHS is a popular aspect of public service. Why is it? Because we all know that people that work for the NHS are people that have chosen to do a job where they're going to be doing something that's meaningful, beneficial, and probably not going to get paid what they should get paid for doing it. That's where the goodwill comes from. Whenever you go to an hospital and you meet nurses and porters and doctors and you sort of go, oh my God, these people, they're so lovely, they're so caring, whatever, you know, like obviously there are limitations, they're not bloody angels, they're human beings. But like that goodwill is being used as a brand. NHS, track and trace. The old NHS, we're just tracking and tracing you. An attempt to utilise your understandable, necessary and deserved goodwill towards people that are willing to do difficult jobs for less money than they deserve is being harnessed by the government in order, in this instance, to data capture, harvest, profit. And like once they've got that information, immunisations, allergies, medications, do you think they're not going to give it to, like, you know, you'll be at some job interview one day, you'll be in some court case one day. You know, this whole idea that if you've not done anything wrong, you've got nothing to be afraid of. Well, who decides what's wrong and when it's wrong and how it's wrong? We don't need these kind of relationships with a sovereign anymore, with a sovereign power. You know, we'll pay you taxes, you stop us getting duffed up in the town square. It's not medieval France. Now we can have conscious, interconnected communities. There are possibilities when it comes to the reorganisation of society, and this information is continually repressed, muddied and obfuscated because it benefits people to keep stuff like this, so that teetering at the top of these pyramids of power, people can keep just swapping about bits of data. So look, information about physical, mental and sexual health will be included there. All like the sort of dark shit that goes on in your psyche, all the mistakes that you've made in the past, private things, what it is to be a human being, available now to whoever wants to use it. There'll be some speech soon where they say, no, we were never going to do it in that way and that was never the intention and all that kind of stuff, if there's sufficient outrage, which there should be. But the fact is you know what the morality and ethics is at this altitude of power. The air is thin there and the morality even thinner. Every single one of these events around your mental, sexual, etc. health will be linked to your NHS number, your full postcode and your date of birth. I know where you are, I know who you are, and I know what you did, and I know what that smell is. Oh, thanks, mate. All your encounters with your GP, once copied to the central database, will be disseminated. That's a terrifying word, and that's a Minority Report word. For payment to third parties, including companies outside the NHS. Well, of course. But remember, the NHS is being sort of privatised. They'll keep hold of that little NHS badge though, won't they? Because that's a branding advantage. Because on some inherent level, we either can't deal with with entities of that size, or we intuit that that amount of power is not good. So it has to be concentrated into a nice little logo or a nice little icon or brand. And here it is happening at the heart of your health. Once this information has been taken, your GP data will never be deleted. Don't you increasingly think that in order to survive, you're going to have to sort of just like cut yourself off from everything? NHS Digital, the central NHS body that Health Secretary Matt Hancock last month ordered to extract all of this health data, ordered it. I don't want to live in this kind of situation, do you? Where someone could just go, hand over the data. That's not what I agreed to. I don't remember signing up for this. Appears not to have sent out a press release announcing the programme via a news item on its own website on the 12th of May. So this is just going down. Why does the government want your data so badly? Your GP record is the most rich and valuable kind of health data there is. While hospitals treat conditions and discharge you, general practice builds lifelong care relationship and records everything relevant to your medical history, be it your physical, mental or sexual health. Do you need some cream for your bum? No. Yes, you do. Have you been depressed lately? No, I haven't. You bloody are. We know more about you than you know about you. You can start to map the steps towards dystopia. You can start to see, oh right, this is how we end up. Oh right, yeah, chips in the brain, information everywhere, regulation around everything introduced for reasons that may or may not be legitimate around health epidemics, and now you are locked in. already it's a kind of freedom that is conditional on participation with some social regulation that could be dubious and maybe at odds with your own ethical values. But as the world's resources deplete, as the world's population grows, as the ecological conditions deteriorate, as inequality increases, it's pretty easy to imagine how things might become terrifying. But the truth is, as God rest his soul, David Graeber said, we made it this way and we can change it. You don't have to cooperate. You don't have to participate. And in particular, with this issue, you can opt out. There's a link in the description if you want to say, I don't want my bloody data shared. I'm going to actually do that right now. If you do want to opt out of having your private genital disorders and mental breakdowns disclosed to businesses that see you nothing other than a walking wallet, potentially with herpes, then you have till the 23rd of June to opt out. The link is in the description if you want to do it. If you're over there in America and it's like behemoths like Walgreens that are coming for your data, I guess you need to organise with other people that are like-minded to stand up and oppose the corporate power that is being continually ushered in under the present administration and isn't likely to be curtailed by any political figure that I can see on the horizon. So you need to generate new power bases among yourself. Good luck. At least in England, you can just click on a thing. So keep your hands out of my pants. In America, you've got to literally overthrow the government. But hey, you've always been ahead of the game over there. If you enjoyed this video, please like, subscribe, comment, tell us what you think. Are you concerned about stuff over there? The old tattoo. If you want to come and see me do some live shows, you can see me do some live shows if you happen to be in the UK. You don't need to tell me your address. I already know your address and I've got all your data. Your tickets are in the mail. No, we're not doing that, of course. So sign up to my mailing list at russellbrand.com. We won't sell your data. We'll just send you emails telling you the stuff I'm thinking and the stuff I'm doing. Go over to russellbrand.com and sign up for that now, particularly if you want to see me live. Thanks.